At our center, we are really responsible for monitoring respiratory diseases and meningitis for the whole of South Africa, and really making sure that there are no outbreaks or increases, and that when government introduces interventions like vaccines that are designed to bring the level of pneumonia or meningitis down, that those interventions are really working, and we're getting our value for money in terms of reducing mortality and hospitalizations and illness. We also have an active research stream which really investigates the causes of pneumonia and meningitis, who is most at risk, and what we can do in addition to what's currently being done to bring the levels of illness and mortality down. World Pneumonia Day is commemorated every year on the 12th of November. And it's really a forum for the whole world to come together to raise awareness about pneumonia. Pneumonia is really important because it's the top infectious cause of death globally. And particularly in South Africa, it's the top cause of death amongst children aged less than 5 years. And on World Pneumonia Day, we really want to teach people that pneumonia, in fact, can be prevented, and particularly pneumonia deaths. And there are a lot of things that you yourself can do to reduce the burden of pneumonia. These include things like making sure that your children's vaccines are up to date, because many of the vaccines that we give prevent against pneumonia or meningitis. In addition, you can make sure you breastfeed your baby for 6 months. You can make sure you wash hands regularly and that your children are trained to wash hands inside your house, that there isn't a lot of smoke, which can affect the lungs of children and adults, and that people don't smoke cigarettes inside the house and around children. It's also very important to make sure that babies and children are well nourished and get the right food, because this boosts their body's immune systems to be able to fight pneumonia. The other thing that it's important to know as a parent is when your child might have pneumonia and what are the danger signs. Pneumonia is an infection of the lungs inside the chest of the baby. And commonly a child with pneumonia will cough, they might have a fever, and they might struggle to breathe. You really should be worried about pneumonia being severe if your baby is showing signs that it's struggling to breathe, or if the wall of the baby's chest is drawing in as it tries to breathe. You should also worry if your baby becomes blue, and if your baby's level of consciousness goes down. In other words, they become very drowsy and very sleepy. If you are worried at all about your child possibly having pneumonia, the most important thing is to take your child immediately to a healthcare facility, either a clinic or a hospital, so that a trained health practitioner can assess your baby and give them treatment. Pneumonia treatment is widely available, and early treatment really saves lives. This year, for World Pneumonia Day, the Center for Respiratory Diseases and Meningitis will be visiting the Iphutheng Primary School in Alexandra, which is very near to our institute. And on our visit, we're going to be educating the children all about pneumonia, what it is, how to prevent pneumonia, how to wash your hands, and we're also going to teach them about the environment and the importance of clean air to prevent pneumonia.
Hi, my name is Mvuyo. I'm from CRDM. Today we are at Iphutheng Primary School celebrating World Pneumonia Day with the grade 3s. Seeing that pneumonia has the highest fatality rates amongst children, that's really fitting that we actually run this awareness campaign with grade 3s just to spread the awareness and spread everything that we can about pneumonia. I think we're having a fun-packed day, sharing knowledge about how to prevent pneumonia and really just doing very fun activities for the children to remember and learn and always think pneumonia.
By NICT kwazi ukuza emphakathini izikolweni ekuthenini umsebenzi esiwenzayo sithethe nabantu abadala okanye abantu abasebenza ngezifo. Kodwa-ke kumnandi uma usiza ebantwaneni ngoba bona bayamamela and ngethemba loba xa ufundise abantwana uba bangazikhusela kanjani kwipneumonia bazawuxelela nabanye xa befika ekhaya abazali ukuzwa izinto ekantshothi esikolweni bazakwazi ukuxelela nabazali. Ke ngoku ukufundisa umntana oyi-1 sithemba uyabakhusela nakwabanye. Ndiyavuya kakhulu kwethu and kwalapha and xa ubona abantwana bavuyile nabo and ba-engage kakhulu kwesi zinto. Ndiyathemba into yoba bazawuqhubekeka into esibafundisela namhlanje bazawugcina nokuthi njengoba sebashiya ii-plants every time bebonisa ii-plants bazakuba i-pneumonia day ithetha ukuthini.
I am a database administrator at the CRDM. So we are here at a primary school in Alexandra where we are celebrating our World Pneumonia Day. So yeah, it means a lot being here actually. I haven't interacted with kids for a long time, so they're actually learning, they're painting, they're planting, so yeah, it's a good day.
jongens vandaag ons besluit dat hierdie skool toe te kom. Soos julle weet is longontsteking rarig affekteer ons kinders die ergste. Soos dit hulle bietjie kom wys hoe om hande te was. En ons gaan ook nou soetjies plant en dan hulle wys hoe om die bome te doen.
Hello, remote Alexandra Monana, Key World Pneumonia Day, Kiloko Iphutheng Primary School. So, the real good of the Tabana, pneumonia, or pneumonia by preventer, and overall, by Nabana Batavile, it's about learning to by tutoring.
Hi, my name is Guy. I'm the photographer for the NHLS. Today has been fun and very educational. Keep it up, keep it up.
Ngibuya CRDM Iphutheng Primary School zofundisa abantwana nge-pneumonia ukuthi bazivikele kanjani and how nokuthi bageze kanjani izandla zabo. CRDM, looking more Iphutheng Primary School, like a World Pneumonia Day. So, about pneumonia or
just really get involved with children. These kids have been so receptive to us and to listening to the message, and so it just kind of makes everything that we do in the lab more relevant, and puts us one-on-one with the people who pneumonia actually affects every day. And yeah, it's been great, it's been fun, and the kids have been so awesome. And so yeah, for me it's just been wonderful, and I just joined, and so it's been a nice way to end the team.
My name is I'm from NICD. Today we are at Alexandra at Iphutheng Primary School. We're here to celebrate our World Pneumonia Day. Whoop, whoop, whoop.
Hi, I'm Annalise, and actually I'm from Switzerland and I'm doing my PhD at the moment. So I kind of jumped in on this project very spontaneously as a second photographer, and I'm really happy I did because it's been such a pleasure to be part of this World Pneumonia Day. And I think it's just nice in general because all the research that we do, for me, it means nothing if we can't bring it over to the people. So it was really nice to take part, and I'm looking forward to another one maybe next year.
My name is Frida Mangani from Iphutheng Primary School. Today it is World Pneumonia Day, and we did it with this company, and it was so awesome. I just want to say today it was so beautiful in a way that people, all our kids, were made aware of pneumonia. They were taught about pneumonia. What is it? What causes pneumonia? And I just want to say this was an awesome day. And for this information, we know that our kids will send it somewhere. Maybe they heard it somewhere, but today they heard it from the horse's mouth because they were taught from the morning. They were taught and they were shown the videos, and they painted, and they planted trees. It was so awesome. And it's for the first time seeing this happening at our school. I just hope it will happen every year. From Iphutheng Primary School, we just want to say thank you so much and peace. Thank you.
Igama lami nguWesley Wadlamini Isibongo. Ukuza kwami la eAlexandra ngokuzofundisa abantwana ngePneumonia ukuthi sivikelela kanjani iPneumonia ukuthi inga spread. And so that was a message besizama ukuyifundisa abantwana namhlanje emaklasini and nokuthi bafundisa abangani babo ngoba badlala lapha estradini. Ngiyabonga.
We delay for World Pneumonia Day. We had fun. bile monate go boletse le bana ka pneumonia go ba ruta gore pneumonia ke bolwetse jwa mofutamang and then le gore ka bo thibela jwang le gore ge ba tshwere ke pneumonia ba ka dira jwang gore ba kgone go thibela pneumonia gore se ke ya ba tsena.
Tell you a bit about our day here at the school. It was really a great day. The kids were awesome. They had lots of fun and took part with enthusiasm into every activity. The day was really comprehensive. It had multi-facets to it. There was educational aspect, there was of course the fun, and I'm hoping that kids took away from this day how to wash their hands properly, so to hopefully prevent illness, as well as the trees and planting can help to environmentally as well, to help with the oxygen and carbon dioxide. And I think the kids had lots of fun and it was a really successful day.
It's been amazing. I've never been surrounded by so many kids, but it was unbelievable. The energy was contagious. It felt like it was electric. They enjoyed us being here, but most importantly, I enjoyed interacting with them.
Ourselves as well as the kids, they enjoyed themselves. We had fun, we danced, we sang. It was wonderful.
And I have a title of ma'am or teacher.
And interacting with the kids is lovely. It reminded me of my younger youth when I was still young.
The experience.
We really had a great experience with the kids.
They were naughty though.
And they really learned about how to wash their hands.
Yes, they did.
We really left the sun with them.
World Pneumonia Day 2019.
World Pneumonia Day 2019. Yay!
World Pneumonia Day 2019. World Pneumonia Day 2019.
World Pneumonia Day 2019.
Pneumonia Day 2019.
I just want to say thank you. May the good Lord bless you and bless you and bless you. Thank you so much and we love you.